everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This next section has to do with community market analysis. A legal disclaimer we put at the beginning of all of our presentations. This information is for educational use only, not intended to substitute for professional, clinical, or legal advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees. Everybody's situation is different, their local regulations, their guidelines, their practice. Objectives of this section: the students will be able to verbalize exactly what is a community market assessment, sometimes called a community needs assessment, the importance of understanding why they're valuable, and then being able to understand the differences between a market analysis for midwifery, a market analysis for your business, a market analysis for a nonprofit versus a for-profit, and to be able to verbalize how do you make a market analysis, how do you implement it, create it, how do you do the step-by-step things to determine if this service line, if this business venture makes the most sense for this area. So the needs of midwifery are so high in today's society, and how we show our value is by creating business plans, by creating community needs assessments, and showing what are the trends for outcomes, what are the service lines that are available, what are the cost for care compared to your competitors. So there's a lot of value in doing a community market analysis, and a lot of people starting nonprofits and birth centers, their state will require them to create a community needs assessment to get their birth center licensure, or if they're applying for a grant, you have to show the mission and the needs of how it's going to be fulfilled in that community and why it makes the most sense to start it here versus somewhere else. So let's go back to the basics. Midwives are really, really important. We take care of moms during pregnancy, birth, newborns the first month of life. We do a lot of amazing services within our communities. And so when we're doing a community needs assessment, you can do it on the angle of primary care services. You can do it on the angle of obstetrical services. You could choose the value and the community needs of a women's health clinic, a niche service, maybe hormones, menopausal support. A community needs assessment could be so many different things within the scope of midwifery. And so throughout the world, midwives have really been that emphasis of helping in their education and the skills that we can do. We can be in the hospital, we can be in birth centers, we can be in clinics, we could be in the home, the community center, birth center. There's so many ways we could practice all over the world. And when you're doing a community needs assessment, do not make any assumptions of who is reading this and what they know about midwives. Like, don't be shocked because it may be a bank, it may be a grant, it may be a business partner that is looking at your community needs assessment. And it's really important to get to the basics of who you are, what is the profession like, what are the statistics, there's some great data out there showing if you start implementing more midwives, what are the improved outcomes that are going to occur. So those really important data to add in your community needs. So let's get to the basics of what is a community needs analysis. There's two different versions of it. There's a community needs assessment, there's community needs analysis, there's market analysis. People will use these words interchangeably, and I want to kind of differentiate when do you use each situation. So a community needs assessment is typically done for nonprofits seeking grants and birth centers within states, particularly like New York, where you have to show to a medical board the community needs assessment to be able to get your license, to be able to get the granting, the foundational funding, the things you're looking for to show the value of why this community needs midwifery care. Some of the community needs assessments are 40 pages long, and I've seen some that are 400 pages long. So it really depends on how in-depth your mission, your company, your service line, where you want to go with things. It has a lot to do with that community needs assessment. It also has to do with what you're applying for in the requirements of that grant, or the business plan requirements to the bank, or the birth center regulations. So it can vary greatly. You're going to talk about the competitors, the collaborations, the services that are currently offered, the services that are not currently offered, the disparities that are present, why your services are going to improve things. There is a void, and they want you to objectively show what that void is and how you're going to fill it. So with a community market analysis, which is a little different, it's more of a strategic planning. It's for business planning, it's for investors. It's more financial than it is mission driven, because they want to know with your LLC, your S corporation, your for-profit entity, how are these services going to stand up to the current competition. We want to know your business is going to be around long term. So they're going to want you to do a good market analysis. What is the population like? What is the average age? If you're planning on doing a birth center, and don't make any assumptions, doing a birth center, you're going to serve women that are 25 to 35 are your prime target. So if you choose a retirement community in Florida that the average age of 70% of the population is 70, the investor is going to wonder, why did you pick that location? There's a lot of things we just assume when we choose, but we have to translate it into objective data that the investors can understand. They want to know the families in your community, the average income. Can they afford your services? Are you going to be cash? Are you insurance? What are the insurance payers in the area and the average reimbursement? They want to know confidently you've done your due diligence. What's the radius look like? What are the families you're going to serve, and how are you going to get out to them? Because they want to make sure you're going to be successful financially long term. So there's a good market analysis you can do with midwifery and neonatal care. You want to show financially, quality measures, the outcomes that are going to be improved, the preventative medicine outcomes, and the ripple effect it has on increasing breastfeeding rates, decreasing C-section rates, improving the outcomes and empowerment of the family unit, and the advocacy, the decreasing of mental health disorders postpartum, the increased advocacy for cost-effective care. You want to include all of that within your market analysis and all the things that midwifery brings to the table. So when you do your market research analysis, you want to talk about your competitors, your collaborators, any family practice physicians, any OBs, any MFMs, any midwives, birth centers, home birth practices, women's health clinics, anybody that's also doing services in the similar industry within your area, because they want to know what's there. They want to know what they're charging. If you're going to charge 5 times more than everyone in the community, you better have a very strong defense of what your stuff is different and how consumers are going to be willing to pay 5 times more for your service line compared to someone else's. Or if you're 5 times less than everybody else, why? Is there something in your value that you're not giving that someone else is giving, or you're just that effective of care? And statistically speaking, your volume should go up very quickly, and so they're going to be asking you questions. If you're far cheaper than all the competitors, how are you going to handle the quick volume of all the new clients when they start calling you? So you have to really understand your services, what you want to offer, what's already currently out there, how you're going to market, how the other people are marketing, what are their missions, what are their values, and what are you going to bring to the community that's different, that's new, that's desperately needed, and why. So many of the countries you want to talk about, especially around the world, you can. It just depends on what your business practice is, your foundation, your goals. If it's a local tiny community you're focusing on, or if you want to change and do a birth center franchise, you're going to talk about the whole country, the United States. If you want to make a international birth center chain, you're going to have different statistics depending on the radius of the people you're going to serve. So when we say doing a community market analysis, don't ever think in our radius. It just depends on your business plan. It depends on who you're going to serve, where things are going, and what's that trend. If you eventually want to start with a home birth practice, but in 5 years you want 20 birth centers across the US, you have to show the different stages. Stage 1 market analysis of your local area, how this stage is going to do successful with the home birth practice, and then when you want to expand to the next level, why that is needed, why that service is going to be successful. So it just depends on how complex your business plan, your mission of your nonprofit, where you want to go is going to determine the radius of your community needs assessment. So a lot of times it's a very research driven objective. It's not going to be a lot of subjective fluffy words. It's going to be numbers, quotations, testimonials, surveys, very objective data showing average insurance reimbursement, showing what exactly potential clients are getting from other services and what they're missing, what they're saying, what they're looking for, what is the average income, what are the population in the area, what is the service lines that are already being offered, how long have they been established. You want to be very objective on your report when you're doing that community needs assessment. If you're going to the larger scale of international changes, you're going to talk about how in the US our fertility rate is different than X country or this country, or even states where you're trying to go, and the trends of needs for midwives and obstetrical and birth care services. You could talk about the retiring obstetricians and physicians and OB specialty care providers and the massive needs that midwives are going to fill, not just in your local community, state, around the world. So it really just depends on what part of the business planning you want to focus on based on who you want to serve, where this needs assessment is going to pertain to. So it has to be very strategic. You have to talk about, this is my plan from day one, this is why. I'm going to start out with XYZ services because none of the competitors are offering it. It's a 2-hour distance to get your pap smear done. We live out in the country. Or there are people offering pap smears, but it's a 6-month wait minimum because they're so busy. Preventative health, well, woman care isn't being offered at that facility. It's only a high-level pregnancy facility. None of the local places can find room for preventative GYN services. So that's why I'm starting a women's health clinic here. Like, you have high-level pregnancy facility. None of the local places can find room for preventative GYN services. So that's why I'm starting a women's health clinic here. Like, you have to show very detailed what is currently offered, what is missing, why am I going to be successful in this community, in this state, in this country, in this area of expertise that I want to offer. You have to show step by step how you're going to get known to new clients, how you're going to stand out from the rest of the services being offered. So definitely planning. You want to have a lot of teamwork and a community needs assessment. It can be a pretty extensive process, especially if you're doing it for a nonprofit, you're doing it for a birth center regulations. It's more smaller and condensed when it's part of a business plan for investors. They just want to know high level, you did your research, your due diligence, that this business is going to be successful here. When it comes to a community needs assessment for grants and for birth center regulations, it tends to be far more stringent and comprehensive, and they detailed will tell you what needs to be key indicators within that a formal community needs assessment to qualify. You can do focus groups. You can say, hey, we're thinking of opening a birth center in a year, or we bought this building, we're doing construction. You can ask 6-8 families to come out and do an open house and talk about what would you like the services to be offered in the birth center, what other color schemes and flow and snacks and philosophy of care, and how would you like to be taken care of while we're developing our policies, our protocols. It just depends on what level of the planning process you're in. Focus groups are definitely a great thing when you're in the thorough depths of the planning process. Community needs assessment, it tends to be more surveys, but they're both a great option to utilize and just get firsthand experience and knowledge from people that live in your community, and what are they looking for needs. What is the community already doing really well? What is the community not doing really well to fill, and what can you do with your vision? You can do forums. Forums are a little larger scale. Maybe you're going to do an open house. Maybe you're going to the zoning board to have a birth center created, and you want feedback from the community. Hey, we just got approved for the birth center to be at this location. It's at the monthly community township committee board, and you just want to have a discussion. You want to have a forum. You want to have some feedback, opinions. Your community is going to be worth its weight of gold to have different perspectives and viewpoints than you're going to to have of challenges, barriers, areas of opportunity. So always take advantage of different levels of conversations, one-on-one, maybe you do a private get-together, you're at family retreat, and something that's a larger scale. You offered a conference, you offered a community day in the parking lot of the new birth center you're opening, maybe you have a women's health clinic already. You're inviting people on a larger scale, inviting the public, inviting labor and delivery nurses, you're inviting physicians, you're touring, you're getting feedback of the needs of what is currently there and what is currently missing. So organizational planning, you want to do step-by-step stages in the community needs assessment. You want to organize things. It's not just something you write in 24 hours. You're going to take you a couple months to do that community needs assessment, depending on how in-depth your analysis is and what you're planning on doing. Obviously, a smaller practice, solo, low-key, is not going to be, maybe it's a few hours of research for that in your business plan versus you're doing multiple birth centers, you have a state that's requiring the very thorough needs assessment, you're doing a nonprofit federally qualified health center, the paperwork, the organization, the details in that community needs assessment is going to look very different depending on what type of business model you're wanting to do. So the whole point, whether they're nonprofit with a board or it's for-profit with business partners, the state regulations are requiring you to make a community needs assessment. It's really about strategically planning based on the results of that community needs assessment. It's going to determine your stages of implementation, where there is a great opportunity that you may not originally thought you would have part of your first service lines. You're going to focus on a certain branding style of your mission based on the needs. Like, you really, based on that responsiveness of your market analysis, making a strong strategic plan of how you're going to implement your midwifery. So there's a lot of great things out there for midwives, and I just want people to understand community needs analysis can be a couple pages. If it's very basic, you're meeting with some investors, they're curious if this town, it makes more sense. Should we do it on the northern part of the state? Should we do it in the southern part of the state? Should we pick this state over that state? They're going to do a community needs assessment with their lawyers, their accountants, their local community. They're going to do a lot of data collection. They're going to determine, is this business more viable to start in town A or start in town B? Should we do a small community hospital area for our midwifery practice, or should we do a large scale city where there isn't a lot of midwives and there isn't a lot of opportunities for this service to be accessed? So there's going to be a lot of decision making of where is the best place to start this midwifery practice based on, is it for profit, is it nonprofit, is it a state that requires a community needs assessment for that birth center? You really have to look thoroughly into those requirement guidelines. If you want grants, you want nonprofit, you want funding, you want the board of director to approve of certain things, you have to show a good community needs analysis.